One of the most common symptoms of kidney failure, whether acute or chronic, is persistent hiccups.
When can a patient know that they have a problem and should go see a doctor? I mean, what are the symptoms that might appear, especially since this topic isn't usually followed up on regularly?
Let's talk here about a patient who has chronic kidney disease. There are certain symptoms. If they appear or worsen in a patient with chronic kidney disease, they must see a doctor or go to the hospital. And what are those symptoms? For example, if they start experiencing persistent shortness of breath. Unfortunately, this is one of the many things that people often ignore or don't pay attention to. Persistent hiccups that don't respond to any treatment. We always tell people, if you have hiccups that don't respond to any treatment, persistent hiccups, or what you call fawak in the Gulf region, we say you need to take this seriously. One of the most common symptoms of kidney failure, whether acute or chronic, is persistent hiccups. All right? Yes. Another thing is that the taste of food and its smell become unbearable for the patient. So food becomes too much for them. How much? No matter how many times you prepare food, it's the same. Sometimes you might notice swelling in the legs. The amount of urine decreases. There is swelling under the eyelids. Another common symptom, which unfortunately many people overlook, is itching or a rash. For example, someone might have persistent itching, God forbid, and go to a dermatologist. If the dermatologist is experienced, they might suggest checking kidney function. Sometimes, when kidney function deteriorates, especially with minerals like phosphorus, which the kidneys regulate, it causes itching for the patient. The patient might use creams for the itching, but there's no response at all because the problem isn't with the skin. The problem is actually with the kidneys. Okay, if phosphorus levels are high, this is usually one of the things I mentioned to you earlier. It's one of the signs you might notice when a patient comes in with kidney-related itching, meaning their kidney function is deteriorating. We did some tests for him and then we transferred him, so we told him, that's it, the cream isn't working and you're moving into the stage of chronic kidney failure. These are what they call the chronic factors that show us all these things: hemoglobin, phosphorus, calcium, and potassium. These are the key indicators we look at. Simply put, if the patient has kidney failure, their hemoglobin is usually low. If it's just temporary kidney failure, then their hemoglobin is still within the normal range. This means something happened suddenly, an acute event occurred. As we said, it could be due to poisoning, medication, or any other cause, or a mistake like lifting heavy weights. And when we remove these toxins, the patient returns to normal. But if it's a chronic issue and the patient has been unwell for a while, we find that their calcium levels are low and their phosphorus levels are high. High phosphorus is one of the most dangerous indicators, and a high phosphorus level is a strong sign that the problem is chronic, because there is no chronic condition that doesn't affect phosphorus. It's just like urea and creatinine, but the kidneys can regulate the minerals. Simply put,